Janice, the cause of this disease is still unknown. They don't really know a lot about what's happening with it, but what do we know about what's been spreading?
So cases have been reported since late October. We're talking about 6 weeks already, which is a bit of a concern because that's a fair time lapse in terms of actually getting diagnostics done. We know that there are flu-like symptoms, so we're thinking fever, headache, runny nose, body ache, those sort of things. Most of the cases have been amongst children younger than 5 years old, and all the severe cases are people who are malnourished. This is a very remote area, and so getting the diagnostics done in a country which is already diagnostic abilities are fairly limited is tricky. It's about 48 hours from Congo, the province that this is happening in, to the capital, and so getting all sorts of other medical supplies is also very difficult. We do know that there are teams on the ground, so that is comforting.
But Janice, I mean, earlier this year we were talking about Mpox, and there was the concern about how it was spreading. How is this potentially different? Are there ways that potentially this can be contained and it's not as much of a concern? I wonder how you'd paint that picture.
So with Mpox, it's not airborne, and this we don't know yet if it's airborne, but it might well be because of the flu-like symptoms, which suggests that. So a non-airborne disease often spreads slower, which Mpox was or is, and this might spread more easily. However, because it's such a remote area, and there aren't a lot of thoroughfares or routes going elsewhere, that does reduce risk, and the Congo is exceptionally good at dealing with infectious diseases. They've had Ebola and all sorts of other things, so that is a mitigating factor. There's also the fact that it may already be this unknown disease might actually be something that just hasn't been identified yet because of the slowness with testing, and so it could be something that's already known, like COVID-19, flu, pneumonia, even measles and malaria. Malaria is very prevalent in the area, so it could be something like that. It could also be a multiple number of diseases that are just showing in this way, because these symptoms, while severe, I mean, there have been a number of deaths, they aren't uncommon to a variety of existing illnesses.